Hello, this is Dr. Moni of Neutrest Dental Clinic. Today, I want to give us a broad overview of what root canal therapy is all about. Root canal therapy is a common procedure in the dental clinic. Basically, it's a treatment to repair and save a badly damaged or infected tooth instead of removing it. It means we need to clean the canals inside a tooth's root. The root has canals. In the past, these treatments often were painful, and with dental advances in local anesthetics, most people have little or no pain with root canal. In fact, it is more painful living with a decayed tooth. So root canal alternatives include extracting this damaged tooth and replacing it with a dental implant, bridge, or removable partial denture. Of course, this is more expensive. There's nothing like keeping your natural teeth than replacing it with an artificial one. So I would advise we go for root canal therapy first before deciding to extract a tooth. So why you need a root canal? Why do you need a root canal? The teeth have a soft core called the dental pulp. This pulp contains nerves, blood vessels, and connective tissue. When a tooth is cracked or has a deep cavity, bacteria can enter the pulp. If left untreated, the bacteria and decaying materials can cause infection or tooth abscess within the jaw and leading to pulp death. This can even cause bone loss. The bone surrounding the tooth can become resolved, and you keep losing bones around the tooth and loss of tooth itself. So there are signs and symptoms that you may see when you have a tooth that needs root canal therapy. Like you can have swellings on your face, you can have really severe pain coming from this tooth. You can be sensitive to cold or hot drinks. Your gum can be swollen, and so on and so forth. Let's talk about this root canal procedure. What do we do when you come to the dentist? A root canal is usually done by an endodontist or a general dentist. So it's good for us to hear that we have an endodontist in Neutrest Dental Clinic here. So the root canal usually takes 1 or 2 visits, but once in a while additional visits are required because some teeth actually prove difficult to treat. So first you have to take a dental x-ray. The dental x-ray will help check the extent of the damage to the tooth. You also need a local anesthetic to control pain, and this may be more severe if the tooth is abscessed. So then we usually place a rubber-like sheet called a rubber dam on the inside in the mouth to keep the tooth clean and protect the tooth and make it free of saliva. So what do we do next? We remove the decay, and an opening is usually made through the crown of the tooth to gain access to the pulp chamber. Then what do we do next? We use all these our small dental instruments to remove the infected and diseased pulp. You must have seen all those instruments, we call it files and all that. So we use to remove the diseased pulp. So clearing up root canal infection. After the diseased pulp is removed, the pulp chamber and root canals are flushed and cleaned properly before we now permanently fill the root canals. Before we permanently fill the root canals, the root canal should be clean of all infection and dry. Clean of all infection and dry. Sometimes medications is put into the root canal to clear any infection. If infection has spread beyond the tooth, you may need a prescription of antibiotics. If the root canals require multiple visits, of course your dentist will tell you. Usually we put a temporary filling on the crown to protect the tooth and keep out debris and saliva from entering the pulp chamber and canals. So after cleaning and drying, the empty pulp chamber and root canals need to be filled. You may not need additional anesthetics for this particular step. So if you add a temporary filling place, that will be removed to allow access to the inside of the tooth, that is the tooth canal again. So what do you use to seal this root canal? We usually use a sealer paste and a rubber compound. We usually call it the gutter patcher. This is used to fill the tooth, followed by a dental fillings to make sure the root canals are protected from saliva or any content entering the mouth. The final stage of root canal is restoring the tooth. We need to restore the tooth. Because the tooth typically has a large filling, or is weakened from extensive decay, it needs to be protected from future damage and return to its normal function. This is usually done by placing a crown. A crown is made of gold, it can be made of porcelain, can be made of porcelain fused to metal. So crowns of porcelain and porcelain fused to metals can be tinted to match the color of your other teeth. So aesthetically, usually these crowns are aesthetically pleasing and it looks just like your natural tooth. So you need to ask your dentist or the endodontist about other restoration options that you might need to know about, so that you can make the right choice rather with your dentist. After your root canal, your restored tooth, we restore the tooth with a new crown, and this crown should work normally and look cosmetically pleasing. If you follow good dental and oral hygiene, your restored tooth should last a lifetime. You should note that the first few days after root canals, the tooth may be sensitive, so over-the-counter pain medication can help. But if the pain and pressure last more than a few days, be sure to talk to your dentist or an endodontist. By the way, let me just do this. This is what an implant looks like in the mouth. Just imagine that's an implant. That's what an implant looks like in the mouth. When you replace a missing tooth, that's an implant. Just by the way, to just show you, some of you that have been wondering what implant is. So thank you for listening to me. Today, I've been able to talk to us about what root canal therapy is all about, what to expect in the clinic. You don't have to be scared of dental treatment. Be sure that with the dentist, you're safe. Nobody would want to inflict any pain on you. So anybody in Bonny, you can visit us at New Trust Dental Clinic in Bonny Town. We will surely take care of you and bring out that beautiful smile of yours. Thank you for listening. Bye.